So let's fast forward from 1923 up to 1970. Now, a lot of things happened in between there. We had the Dirty 30s, we had World War II, and then we moved into the 50s and the 60s, where we started to have a little bit of counterculture started to happen in the 60s, especially with the youth. Vietnam War, the youth were really protesting that unwarranted war that was going on with our neighbors to the south. Canada did sit that war out, but still we were kind of involved in that counterculture happening. The world was changing. Some of the puritanical views of like the early 1900s, the prim and properness was, people were starting to get a little tired of that, trying to shed some of that stiffness in society. Things were a little bit freer. And throughout this whole time, didn't matter that cannabis was now a prohibited drug. People were still growing it. People were still using it for medicinal reasons. People were still using it for recreational and spiritual reasons. What did really stop was using cannabis as a tool. So we were using it for food or for oil or to make other products out of. But it was still being used as more recreationally and medicinally. But the people who were using it medicinally had to do so underground. They really had to either be growing their own or have someone grow it for them, and really risking their liberty to use it. Can you imagine if you relied on something as simple as, say, a Tylenol or antihistamine or something like that you can just go into the drugstore, buy it over the counter, and it makes your life so much easier? Well, these are people who were using cannabis just to help with some of the health conditions that are really easy to manage, such as arthritic pain or sleep or digestive disorders. They were really easy to manage with cannabis, but all of a sudden you can't go down to the store and buy it anymore. And then it becomes these health issues. Instead of just being a minor annoyance that are easy to control, they actually become a big, huge issue for people who now don't have a means of managing that. So that was what it was like, and people were willing to risk their liberty in order to have their medicine so that they could have some sort of quality of life. So there was a lot of pressure on the government of the time. Of course, Pierre Elliott Trudeau, back in the late 60s, early 70s, was our prime minister. And so he commissioned what came to be known as the Le Dain Commission, or the Le Dain Report, on cannabis and on other drugs. So there was these really harsh penalties for possession of drugs, and we started to say, like, is this really necessary, and should cannabis really be included in these laws, because it seems kind of harmless. And so Mr. Le Dain was asked to put that together, and it resulted in a 320-page report. Now, the 320-page report didn't just cover cannabis, but it covered things like alcohol and some of the other drugs that were being used either recreationally or as it's kind of contraband medicine at the time, and basically ended for the argument of mandatory jail time for people who were in possession of some of these substances. That argument is still going on today. Is it a criminal issue, or is it a medical issue, or is it a societal issue with some of these drugs that people are using? So the Le Dain Commission recommended, it's like, hey, cannabis shouldn't be included in this. Why don't we just free this plant? It's not a big issue. And that was the recommendations that came through, but they were never acted upon. Some people say is because of great pressure from the United States, our big neighbor. So the US, the powers that be in the US were saying, like, hey, we've got this big, long, open border. If you decriminalize cannabis or marijuana, we know that a lot of citizens, or the US citizens, are going to come across and buy it up and bring it back into our society, and we want nothing to do with that. We could go on a whole thing about starting back in the 70s and then especially start to ramp up in the 80s about how mandatory sentences for US citizens for simple possession were starting to fill up these for-profit prisons. It's quite a mess, but I think that's a course for a whole other time. But needless to say, cannabis Canada was under great pressure from the Americans to not legalize this plant or this drug. And I love this picture of Mr. Trudeau with Yoko Ono and with John Lennon, because John Lennon and Yoko Ono went on this kind of round the world tour saying like, hey, this is just a plant, peace, love, and rock and roll. It's not hurting anybody by taking it. In fact, it helps people to calm down and to maybe open their minds to a few other things. So what a great historic picture that we have there with Pierre Elliott Trudeau and John and Yoko. The other thing with Pierre Elliott Trudeau is his wife had a bit of a reputation. Of course, there's all kinds of pictures of her dancing with Mick Jagger and hanging out with the Rolling Stones back in the 70s. And Maggie Trudeau was quite open about her use of cannabis to help with some of her mental health issues. And she was a very open user. And so it started to become, there was a lot of hypocrisy in the law enforcement because, of course, being the Prime Minister's wife, she was kind of given free rein. Everybody just turned a blind eye to the fact that she was openly using cannabis, where a lot of college students and youth and people who are using it medicinally, especially if they were using it openly medicinally, there was they were getting arrested and getting criminal charges against them and having criminal records for the rest of their life. Fast forward to after Maggie and Pierre did divorce, and in 1988, she was then the ex-wife of a prime minister, so she didn't have that immunity anymore from the law, and she was arrested for being in possession of a pound of BC bud. That got mailed to Montreal, so that was when cannabis was still being kind of moved across the country through Canada Post. At the time. So someone alerted the authorities that she would be receiving this package of BC bud, and she was arrested for that. It's interesting to note that Maggie Trudeau is still very vocal about her struggles with mental health, and she did, in more recent years, she did stop using cannabis because she felt it was no longer doing her mental health any good. It wasn't helping her at that point. So she has since saying, yeah, I'm moving off of it now. I've moved on to using other things. So another interesting thing with the Trudeaus and cannabis and this fight for a liberation of this plant is that one of the Trudeau boys was caught in possession of cannabis and had a bit of a record. And some people feel that both for Justin's mother and Justin's brother, and the brother tragically died in an avalanche back in the late 1990s. But some people feel that that was Justin's motivation for bringing some sort of legalization to this cannabis plant, because he saw it in action as he was growing up with his mother, and he knew it wasn't the dangerous drug that sort of the propaganda against it had happened. So let's fast forward to 1998 now. Again, the struggle is still ongoing. We've got by this time we have lots of activist groups that are really working hard to lobby to free this plant because it does so much good medicinally for people, helps to calm them down. And then we also have this great resource of the hemp plant that unfortunately got sort of caught up in the whole marijuana prohibition. So we no longer had access to this plant where we could make paper and we could make building material and we could make plastic alternatives with it, a great source of food and both edible oil and industrial oil. So on the 50th anniversary of the Universal Declaration of Human Rights, Diane Riley published a report on drugs and drug policy in Canada. So again, this struggle to say, are drugs really a criminal issue, or can society approach the drugs and addiction issue in maybe a little more humane way? So Riley's report concluded it is time to reframe the problem. For decades, there's been this futile debate about whether self-destructive drug use is a criminal problem or a medical problem. I hope that it can now be clear that it is neither. It is a political problem. And we're having the same argument today with some of the street drugs that we have that are killing so many people out there. So this is an age-old argument. Maybe we'll finally get things right in the next decade or so. But again, we have been talking about this for decades. This is not a new issue. So that was 1998. And by 1999, we finally got Marijuana for Medical Purposes, an act that came in. Now, this was an act that wasn't easy to follow because it was, first of all, really difficult to get hold of the product. You had to have a doctor who was willing to prescribe it. And very, very few doctors in Canada were willing to go out on a limb and say, hey, I want this person to be using cannabis in a medicinal way. So even though we had this sort of medical marijuana first iteration of it, it was a difficult one for people to get a hold of. And so the black market did still continue through that. So again, in response to Canadians are still demanding legal access to this plant, and they're starting to push the medical purposes because they thought, okay, they're not going to let us have this for recreational purposes. So let's see if we can push something through on the medical side, and really showing how it was helping so many people by using it as a medicine. So the plan concludes that their research initiatives will help those who are suffering from terminal illness, for instance, and who believe that using marijuana under controlled circumstances could alleviate their symptoms and improve their quality of life. So here was a way of getting at some sort of legalization of cannabis use for end-of-life issues, because, you know, even if it is a dangerous plant, which it is not, but even if it was a dangerous plant, then people are dying anyway, and so why not give them a little bit of comfort? It can't do any harm. So this was a great angle to start to come at in trying to get some sort of lift and freedom for this plant, so the people wouldn't have to be risking their liberty for getting it. We have another historical perspective, a PhD dissertation from Catherine Carstairs. She put this together on the history of drug use, regulations, and resistance in Canada. I do have a link for that in the notes here. This dissertation asked 3 questions. And again, these 3 questions are still being asked today, years later, a couple of decades later. What happened to drug users when the drug use became a criminal activity? How did the state implement control over consumption, and how did the drug users respond? And we know now that a lot of that, when that drug supply goes underground, goes into a black market, then we're fueling criminal activity, and we get really unclean products on the market that then can become quite dangerous. And we can see even today, even more today, we have the opiate crisis, where the products that are on the street can be laced with very dangerous products, and we're getting a lot of deaths from those. The main conclusion with this paper said the anti-drug narratives depended on race, gender, and generational tensions, as well as class inequalities, to make their stories appealing and real. Things are not so different today, right? So again, this age-old question has been going on since the beginning of Prohibition. So from 1998 to 2001, we finally get some sort of a regulation, access to cannabis that has at least a little bit more freedom and leeway to allow people to actually access the cannabis. And that was brought about through a court of appeal. At the Canadian Court of Appeal, declared that the prohibition of cannabis for medical use was unconstitutional. People were saying, like, look, you can't take my medicine away from me. If you take this away from me, I'm going to be really sick. I won't be able to work. I can't live my day-to-day life. And so our first iteration of cannabis legalization, if we want to call it that, was the MMAR, Marijuana Medical Access Regulation. And that provided the holder of an authorization to possess, the holder of an authorization to possess is authorized to possess dried marijuana in accordance with the authorization for the medical purposes of the holder. So basically it said, if a doctor has said that you can use this product, then you can legally use this product. Now, how did they get hold of the product? You had to buy it from the Canadian government at that time, and I believe they were growing it in bunkers in Manitoba. It was a limited supply. It wasn't very good product, and it was hard to access as well. Some of the conditions in that early one kind of set the standards for even what we have today that were just built on. So conditions for authorization included terminal illness. So if you have been diagnosed with a terminal illness and all conventional treatments had been tried, then they would let you use some cannabis to help you sleep or manage pain, or just to sort of help that transition between living and the fear that can happen when you're facing death. A couple of other conditions: severe nausea, cachexia. Cachexia is basically a wasting syndrome. We started to see a lot of that with the HIV/AIDS epidemic. People just aren't able to either or don't have an appetite or just are not able to absorb the nutrients of the food that they're eating, and their body starts to waste away. So that's cachexia. And then anorexia, we're not talking about the mental health issue of anorexia. We're actually talking about anorexia, the true meaning of the word, which is lack of appetite. And that would come about from some like chemotherapy treatments, other drugs really cut down the appetite, and people without an appetite have a really hard time getting enough nourishment into their body so that their body can heal. Persistent muscle spasms and seizures were also included in that, and severe pain from cancer, AIDS, HIV, MS, spinal cord injury or spinal cord disease, or epilepsy. So a really limited number of symptoms that a doctor could prescribe the use of cannabis for. The last things about the MMAR, this is our 2001 Act, is cannabis could be attained by personal production license. So you could cultivate it your own. So that means you could grow it yourself. You couldn't legally get the seeds from anywhere, but you could grow it yourself. You could magically create these seeds. You could purchase directly from Health Canada. As I said, I think they had one grow up in a bunker in Manitoba. They were growing it underground. Or you could designate a third party to grow it for you. And that's how a lot of people were doing, is designating growers so that they could at least have a better quality product. That's where a lot of these growers that were sort of in the underground market. Now, of course, a lot of them were just in it for the money, for the recreational use, but there were some really dedicated growers that were growing different strains for their medical patients. And they would develop those strains over the years to better target some of the medical conditions. Okay, moving on from MMPR, we get to MMAR. So marijuana for medical purposes regulations. That came about in 2013. And what this did is it basically said that a doctor can kind of prescribe the cannabis, where before it was just kind of recommended, then you had to apply to Health Canada for a license. So now it's like took away that requirement for a license, a government license to be issued, but you still needed a doctor. You were authorized to possess dried cannabis flower, and personal use production, just meaning you could grow your own, or you could designate a grower for yourself as well. And then it made it much easier to have access to both seeds and dried cannabis flower. This is really what opened up the door for the beginning of our commercial growers. So companies like Organogram and Tweed, that were kind of some of the original Canadian LPs that kind of got started, they got their start around 2013, 2014 is when those companies kind of got started. And they became sort of the just a couple of the licensed producers that were available at the time. So instead of only having one source, the government source to buy your product from, you could actually had a few more sources that you could purchase from then. Consequently, some amendments kind of came about to that because up until then, you could use your flower, but you weren't allowed to turn those buds or that flower into any kind of product. So you couldn't legally make any brownies or edibles or your own oils or anything like that. It was only flower was allowed. So eventually that did relax a little bit so that people were able to legally make their own edibles. Of course, they were doing that anyway, but it just officially made it legal, so you didn't have to worry about when you were transporting them. So that was 2013. So moving right along to 2016, of course, Justin Trudeau, who became Canada's Prime Minister in 2015, one of the platforms that he ran on was that he was going to legalize cannabis for the Canadian public. And so it was already kind of legal for medical purposes. And so that got refined a little bit around 2016 with ACMPR. So we went from the, those first couple of acts to the ACMPR. And this basically even opened things up even more. And this is when we really started to see the medical system in Canada starting to take off, was in 2016, where some of the health conditions were quite relaxed then. So instead of just having a very cut and dry list, there was only, a handful of health conditions that could be prescribed cannabis. It really opened it up. So we still had the same ones that have always been there, like nausea and vomiting, especially associated with cancer or chemotherapy. So now if you were a cancer patient undergoing treatment, you no longer had to, sneak behind the back of a building in order to smoke a joint and calm down the nausea and vomiting. So that was now legally prescribed to you. Also loss of appetite and that cachexia or loss of body weight for cancer patients or HIV/AIDS patients as well. Pain and muscle spasms, especially associated with multiple sclerosis, works really well for some of that neuropathic pain. That became those two types of pain became quite easy to obtain cannabis authorization for. Any pain associated with a cancer diagnosis was also on that list. And then we finally get it opened up for things like insomnia and depression. So now you could go to your doctor and say, hey, I'm not sleeping. And instead of having to take those traditional sleeping pills, if you just needed a little bit of help, either falling asleep or staying asleep, you could definitely get your doctor to prescribe you a cannabis for that. End of life or palliative care was still involved in that. And then here's where it really opened things up. So it's just other symptoms or condition authorized by the healthcare practitioner. Now the rules do say that the patient has to have exhausted all other methods of managing their health condition before they turn to cannabis. But the interpretation of this law really opened it up to say, hey, when you use cannabis for medical conditions, that's between you and your doctor to decide if that's right for you, rather than the government just saying you could only use it for very specific health conditions. So now we get a little bit more freedom for health uses of cannabis, because that allows us to for the doctor and you, the patient, to make that very personal decision as to whether cannabis would help in whatever your health condition is. So it really opened the door. And with this opening of the door, we started to see a lot more growers or licensed producers. So Health Canada authorized growers of cannabis and cannabis products really started to flood the market. Also because Justin Trudeau had kind of campaigned on that promise of deregulating or putting some sort of legalities around recreational cannabis, the big producers started to realize, hey, there's going to be a market here for cannabis. And so we started to see around 2016, we started to see a lot more licensed producers start to jump on board. Back in 2016, we might have just had maybe half a dozen licensed producers that you could purchase your medical products from. And now we're up to, there's 50 or 60 of them out there right now, and the list keeps growing. So, and again, the same provision was still in there, allows a patient to grow their own product or grow it for someone else. But in order to grow it for medical purposes, you still needed to have a prescription. So that still didn't allow the recreational user to grow their own, to legally grow their own product. So that's where we're at with the medical, and that system has basically largely remained the same since legalization happened in 2018. So let's look at the steps that moved into the 2018 legalization of recreational cannabis. And we got the framework for that in 2016, around the same time that ACMPR came into effect. So again, following through on his election promises, Mr. Trudeau assigned a task force and created this framework for what it might look like, what legalized cannabis in Canada might look like. And the framework sought to strike a balance between implementing appropriate restrictions, so restrictions around age, use, those kinds of things, in order to minimize the harms associated with cannabis, and to provide adult access to a regulated supply of cannabis while reducing the scope and scale of the illicit market and its social harm. So it really looked to how can we still keep this a safe product, keep it out of the hands of children, but try and cut out some of the criminality that was in the industry at the time and make sure that there was a safe supply for everybody as well. So that framework led to Bill C-45 that went through. And just an excerpt for Bill C-45 is, once the act comes into force, adults who are 18 or 19 years of age and older, and that is dictated by the provinces or the territory, they'll be able to legally purchase, grow, and use a limited quantity of cannabis. Until that time, he did say cannabis does remain illegal in Canada unless it's authorized for medical purposes. So people were starting to jump the gun a little bit on things. So that was said, hey, it's just hold on here. It's not legal yet, not going to be legal for another couple of years from 2016. And so fast forward to October 17th, 2018, that was quite a momentous day in Canada. We were the second country in the world to legalize both medical and recreational cannabis. And this allowed for the sale of dried flower, oil extracts, and clones and seeds so that you could purchase your own. Now, the clone and seed market is still in kind of its infancy. It's really difficult to legally purchase seeds and clones right now. And there are some companies out there that are kind of exploiting that market and charging $50, $75 for one seed. You don't even know if that seed's going to be viable or not. So we still have some things to kind of go through in that area. But that's 2018, October 17th, 2018 is kind of our Cannabis Day in Canada. The Cannabis Act does allow anyone without authorization from a doctor, you don't need any authorization, anyone who is of age in the province to purchase 30 grams of product per day. So you can go down to a store, you can buy 30 grams of the product every day. The stores are required to restrict that purchasing power, but somebody could go back every day and buy 30 grams every day. However, you can only travel with 30 grams in your possession as well if you're a recreational user. Recreational users can grow up to 4 plants per household, with the exception of Quebec, where you can grow 0 plants per household. So Quebec doesn't want anyone growing their own. You can transport and use the product, but there are some restrictions in that, again, depending on the province. If you're transporting it in your car, of course, you can't have over the 30-gram limit, but it also, in most provinces, has to be out of reach of the driver and other passengers, in the same way that alcohol is restricted when we're transporting alcohol around. So the legal age to purchase is 19 in most provinces. Health Canada does say that the provinces have to allow only 18 and older. So no province can allow anyone under the age of 18 to purchase, but the provinces are able to set whatever the limit is, the age limit that they want. So most provinces are 19. Alberta is 18 because Albertans can also purchase liquor at age 18. All the other provinces are 19 for liquor as well, except for Quebec is you have to be 21 in order to legally purchase cannabis in Quebec. So the federal government has kind of put in place the framework of the legalities around recreational cannabis use, sale and use and distribution. The provinces can take those distribution laws and kind of mold it to the province that they're in. Most provinces have taken on the model of the way alcohol is distributed throughout the province. So, and some provinces have cannabis only being sold in government-controlled stores, and other provinces have more a mix of both government and private stores. So there's a few different models across the country, in the same way there's a few different models of how the public can purchase alcohol in different provinces. Then we get down to the municipal area. Municipal laws municipal laws control the places of consumption. So whether you can consume it only in your own house, or whether it's allowed to be consumed in a public park or in beer gardens at festivals, those kinds of things, that's all under control of the municipalities. And then landlords can overwrite some of the municipal laws unless it's medical-based cannabis. So there's still some struggles going on there. If someone is a medical user and they're in some sort of public housing, and their best method is to smoke the cannabis, that creates, smoke that goes into the air that perceivably could get through into other people's apartment buildings. So we still have some things to work out in that area, but it's just showing the different controls, who has control over the different areas of how we use and consume cannabis in Canada.